physician serving at the Al Aqsa and the Nasser hospitals in 2024, Dr. Mimi Sayed, and she has now been denied entry to get back into Gaza. Dr. Mimi Sayed, we are welcome to the show, and wonderful that you're able to join us.
Hi, thanks for having me.
Yes, it's actually a very, very scary thought, and I know you have been denied entry into Gaza, but once again, reflecting what this genocide is all about, we know about journalists being killed, we know about many medical people that have been killed as well, together with their families, but also at the same time, people like yourselves not allowed into Gaza, just as the case has been with foreign journalists that have not been allowed into Gaza. Just a very, very scary thought. And particularly when you have messages coming through from young children, from young medical students, so desperate, saying that they actually want to die.
Yeah, I mean, I think it's horrific, and there are many reasons why we're denied. I'm not the only physician that's been denied. No one in my group has actually entered this yesterday when we were supposed to enter. Previously, I've been given clearance 2 times to get into Gaza, and so I don't understand why I wouldn't be allowed in for the third time. My colleague, who is also from France, who has also been to Gaza, was denied yesterday as well, and this continues to happen, and for the past few months, there has been an increase in denials for many healthcare workers and physicians from entering, and it's just another way of destroying the healthcare system. And I've said this before, but the healthcare workers in Gaza have been working endlessly, volunteering for the last 2 years almost, and they're now starving. They're sick themselves, so this little relief that we can provide has also been taken away from them. Not to mention, some of the medical supplies that we carry when we go in, the life-saving skills that we possess when we go in, all of that is systematically being taken away from them. And it's another act of cruelty, another, intentional, deliberate act of dismantling society in Gaza.
Well, certainly, and I can concur with what you're saying, Dr. Mimi, because we've had the opportunity. A few weeks ago, I had the opportunity of speaking to one of the healthcare workers in Gaza, directly out of Gaza, and we can concur their own experience in terms of starvation, in terms of hunger, in terms of concern for their families. We know the case of the doctor that lost an entire family, 8 children, and her husband as well. So the pressure is immense on healthcare workers and people like yourself, and also many other would actually want to go to provide some relief to the people of Gaza. And I'm not too sure what is now left of the healthcare system, because we know that has been totally destroyed throughout the last 23 months of this genocide. And just the mere fact that you and your colleagues are not allowed in speaks volumes.
Right, and we're not given any reason. Any time that we are denied, there's no reason given. There's no process where we can ask, what was the reason, or if we can appeal it. And so I think, this is just another way to continually deny care to the people of Gaza. But we do need pushback. We need world organizations to push back and ask, why are you denying healthcare workers and humanitarian aid from entering? I think that a lot of the reason why we are denied is that when doctors like myself go in, we report on what we're seeing and what we're witnessing, and that exposes the truth. It's the same reasoning behind killing all of the local journalists in Palestine. It's the same reason why Israel doesn't allow foreign journalists to enter Gaza. It's because we expose the truth, and that is, that's what they don't want. But it needs to end, and they do need to be held accountable for this. At the very least, reasoning needs to be given as to why humanitarian aid isn't allowed in.
Yes, in fact, I think to a large extent, a lot that has come out of Gaza by way of reporting has come through via people like yourself and many other medical professionals who have been in Gaza to expose the horrors, the savagery, and the brutality of this genocide, and to a large extent, in the absence of journalists, we have become almost totally reliant on people like yourselves, Dr. Mimi.
Yes, exactly. And and we do expose as doctors, we frequently document our work, and not just in Gaza, but as a practice. But this is no different. We report on the evidence that we're seeing, the data that we are seeing, and we report on it. But also, you did mention the medical student's desperate plea to us. That's my medical student that I worked with, and I have been mentoring her for the past year that I met her. And just to hear a 25-year-old medical student saying that she would rather die than endure this suffering, it's heartbreaking. And for the world to hear that and look the other way is a completely another level of just cruelty. So this needs to stop. Aid needs to be allowed in, unlimited aid. There needs to be a permanent and sustained ceasefire, and there has to be accountability on the acts that have already been committed and the people that have unjustly been killed. A recent report was released from the Israeli news media about 85% of the people that have been killed in Gaza are civilians. That's their own government reporting those numbers. And so why is this still happening today? Why are we continuing the bombardment? Why are we continuing the siege of Gaza City right now as we speak?
Yes, I'd just like to expand a bit more, Dr. Mimi, on the student that you have been mentoring, and for a young person to be experiencing what the student has been experiencing. And I'm sure it's not easy for yourselves as well, because even as a medical professional, one can never ever be prepared for the horrors that one actually sees or faced with on a day-to-day basis. And this, I've had the experience firsthand, where we've brought a group of young medical students to from Palestine, from Gaza. We brought them to South Africa to complete their final year studies, and one could actually see from their faces, from their body language, from their reaction, the fear factor, the shock, and a lot had actually, in fact, with the aid of psychologists as well, a lot had to actually be done to get them in that right frame of mind. So I can just imagine when this student just says, I want to die, after having experience, and we're talking of a very young person. And, for experienced people like yourself, obviously it's horrific. One can only imagine what it does to the mindset and the psyche of a young person to make a statement like this.
Yeah, I mean, I remember when I got the voice message from her, and there was the announcement by the Israeli government that they would be taking over Gaza City and evacuation orders would be given to the people there. And this would have been, multiple times she's already been displaced. And she actually called me in the middle of the night because she had no one else to talk to, and to tell me that, I'm sorry, I'm not evacuating, and I know that I will be killed. I mean, I'm sorry that I failed you. She was saying that to me. And I had to beg and plead with her to please evacuate, please go where they're telling you, please, you cannot, please don't give up hope. And after being on the phone with her for so long, finally she agreed to evacuate. But even now, when I ask her today, just this morning, I talked to her, and she said, I have no place to go. We're going to go on the street. We're going to the street in the South. We have no place to go. Imagine just the space, the amount of space that we're talking about here. And I can talk about it in terms of the United States. The entire Gaza Strip is a tenth of the size of Rhode Island, the smallest state of the United States. And that is going to be reduced by 88% for 2 million people, almost 2 million people. And so naturally, you are going to have people that are refusing to evacuate because there's no space. There's no place to go. So they are going to continue staying in the dwelling that they're staying in Gaza City rather than being displaced. And naturally, what's going to happen is they're going to be bombed. They're going to be killed by the Israeli government, just like we've been seeing. And for some people, that's a form of relief because it's going to end their suffering. So this is, I have no more words to articulate how heart-wrenching and how cruel this is. And every day, I mean, we all watch it live stream on our phones. This continues to happen. She sends me images of children. Just this morning I got images from her from Shifa Hospital of children with their bowels out of their abdomen, their brains out of their skull. It's been happening for almost 2 years now. When does it stop?
Well, absolutely. And this is a question that many of us are asking. Dr. Mimi, we're going to go for a quick ad break. I'm going to put you on hold. We'll be back in a minute.
This is Salam Media. They say breakfast is the most important meal of the day, yet many children go to school hungry because of poverty. Penny Appeal South Africa's Breakfast Club aims to get a warm, hearty meal to underprivileged children so they can spend their day prospering in their schoolwork. Help feed a needy learner for only 5 Rand a day, or 150 Rand a month. Or visit our website www.pennyappeal.org.za or call 031 1100 573 to find out how you can donate. Penny Appeal South Africa. Small change, big difference.
You know, it's a wonder how kids get anything done these days. With all the distractions, when do they even get time to study? As a mother, all I can really do is make sure they have all they need to perform at their best. That's why I choose to include Sunfoil, triple refined pure sunflower oil with every meal I make. Naturally cholesterol-free and approved by the Heart and Stroke Foundation as part of a balanced eating plan. So whether I'm cooking, frying or baking, I know every dish will be a wholesome one. Sunfoil, now we're cooking.
Gaza needs your support more than ever. Homes have been shattered and families have lost everything. With your support, our teams are delivering clean water tankers, feeding the hungry, and assisting orphans who have no one left. Let us give Gaza whatever help we can. African Muslims Agency, empowering, educating, inspiring.
Discover the Africa of your dreams and surround yourself with her spectacular beauty. Relax beneath her serene sunsets and explore wildlife at its natural best. It's where the pride of Africa comes together. The Kwantu Private Game Reserve. Get to know the Big Five or cruise on an elephant safari game drive. Interact with lion and tiger cubs and enjoy world-class halal cuisine while we pamper you during your 5-star stay. Indulge in the true African experience. For reservations, call now on 042-203-1400 or visit kwantu.co.za. The Kwantu Private Game Reserve, the place of gathering.
Breaking stereotypes, moving boundaries, joining hands. Salam Media. Humanity sets the agenda.
Well, we continue our discussion this morning with Dr. Mimi Syed, emergency physician, who has now on an attempt for the third time trying to get into Gaza, has been denied entry. Dr. Mimi, just to continue, and we've seen this over the last 23 months, Salam Media had the opportunity of inviting Dr. Max Gilbert to South Africa in November 2023. And at that point in time, he spoke about the deliberate destruction of the healthcare system. It was one facility after the next. And we've got now to a stage where there is absolutely very little relief from a medical perspective, and the little relief that people like yourselves and other medical professionals try to offer, that is also now being revoked, that is also now being taken away by the refusal. Just your thoughts on international bodies like the World Health Organization, the United Nations, and I'm sure many medical professionals have been calling, knocking at the doors of the World Health Organizations and international bodies to actually do something about it. And we see all these demands for a ceasefire taking place, and even with the most recent demands that have been taking place, we find that Israel continues shifting the goalposts or just basically ignores these calls for a ceasefire. What are you hoping for, as far as these international bodies are concerned?
Yeah, I think, Israel has impunity to do whatever they please. And I think that the world organizations like WHO need to push back, and like the UN need to push back. And this is just unacceptable at this point to continue to accept their actions. For example, if physicians like myself are being denied, if humanitarian aid is being denied, and we need to have pushback by WHO as to why. Why make it easy for them to continue to deny us without reason? There has to be accountability, just like there is for every other country in this world. I don't understand why there is a double standard when it comes to Israel. So yes, pressure needs to be applied by as many organizations as we can. But to your point about the deliberate, destruction of the different levels of the healthcare system, as far as I'm concerned, when I went back and when I was there in August, I thought that the healthcare system was pretty much destroyed at that time. And to see it now there is no healthcare system. The healthcare workers are not able to really provide any care. Most of the patients end up dying, even if they do have intervention, because of the living conditions that Israel has created in Gaza. Patients end up dying even if they do receive any kind of surgery because they're starving, they're immune compromised. There's overcrowding. There's diseases like Guillain-Barré syndrome. I just saw a little girl with a trach because she has Guillain-Barré syndrome. And there's no treatment for it because there's no treatment allowed inside. That was one of the things that I was carrying with me, was a plasma exchange filter to hopefully help somebody with it. But again, doctors like myself getting denied with things like that. So, and not to mention the basic life essentials like water, food, cleaning agents like soap and disinfectant agents, antibiotics, medications. If these things are not present, really, there's no healthcare system, right? If you live in a tent with dirty sand, no electricity, no clean water, the healthcare system is non-existent there.
Yes, but also I think a few weeks ago I discussed the psychological trauma that is associated with this genocide. Where on the one hand, I know you speak about basics and we speak about basic healthcare that is not provided, but also at the same time we know that the psychiatric hospital was brought to the ground as well. I'm sure that there is a massive shortage of medical professionals to deal with the psychological impact and the consequences of this genocide, the trauma associated with it, the generational trauma that the people of Gaza are suffering in the absence of basic medical care. That again takes this entire genocide to another level from a medical perspective.
Absolutely. And children, I mean, and we talk about children having to witness their parents die in front of them, or another child being amputated, in front of them, seeing children around them get killed on a regular basis. I never saw so many children that wanted to die that I did in Gaza. And these children, they want to die and they want to be with their families, to be with their families, or to just not be enduring the suffering that they're going through currently. And I know a colleague of mine that's a psychiatrist that recently got denied entry as well, just a couple weeks ago. So there's so many levels of this, and you don't even begin to uncover the psychiatric portions of this and the long-term damage that's being created and engineered here in Gaza. This is not something that is going to be over, even if there is a ceasefire, even if there is aid allowed in. This will continue for decades.
No, absolutely. And also, I think no matter how experienced a professional can be, whether medically or psychologically or psychiatrist as well, I don't think one can be adequately prepared to actually deal with a situation like this, because this is in its most extreme forms, Dr. Mimi.
Oh, absolutely. And I mean, we're talking about, if you want to talk about people like me who are not even living there, the trauma and the preparation that we have to have as, to be trained to see what we saw in Gaza, it doesn't exist. Even as an emergency doctor, I've seen trauma surgeons that have been to other conflict zones. When they go to Gaza, they even say there's nothing like Gaza. What we see in Gaza is unprecedented. And imagine being a healthcare worker in Gaza that has been seeing this for 2 years now, every single day, multiple times a day. I don't even begin to imagine the trauma that they have, the psychological trauma that they have. There is no training for that.
Yes, and also I think often we've heard about the true heroes being the medical personnel in Gaza, the Palestinian medical professionals. Perhaps just a word or two, your observations, because they are the true heroes, having to deal with this extreme form of brutality.
Absolutely. They embody the work ethic that healthcare workers should have all around the world. I've seen healthcare workers that are being actively displaced during evacuation, and then they still show up to work. Healthcare workers that just lost their family member. I remember a nurse at Nasser Hospital when I was there in August who was working right alongside me. And her sister had come in as during a mass casualty and was shot in the head by a sniper, and she didn't recognize her because her eye had been eviscerated out of her skull, and so she didn't recognize who that was. The only way she recognized her was by her clothing, and she was working alongside me, and she saw her sister, recognized her. Her sister ended up dying. An hour later, that nurse was back next to me, working again as a nurse. I just I can't imagine the trauma, but I can tell you that the healthcare workers in Gaza are there. There is no one that compares.
Dr. Mimi, at this point in time, now that you have been refused entry, what more can you do? Can you lobby your government? Because we know what is, as far as the United States of America, obviously a very, very active participant in this genocide, complicit in almost every way whatsoever. Is there any more you can do in terms of lobbying your government? But again, we've heard about the United States of America preventing people from going to Gaza.
Absolutely. I mean, I have been doing advocacy work ever since I left Gaza, and I won't stop. And this doesn't stop me. Just because I was refused this time doesn't mean that I will be stopped from doing advocacy work. I absolutely plan on continuing the work that I've been doing and talking to whoever is going to listen and try to make change, because we all have to say something. It does not matter who you are. We all have to speak up. We have to do what we can in our capacity, whether it's protesting, whether it's, divesting, anything we can do to stop this. I think, as a mother of three small children, I cannot bear to raise children in a world where children in other parts of the world are just shot in the head or killed indiscriminately or starved to death. I can't bear that. And so I will do everything in my power to stop this as soon as I can. And I know that all of my colleagues are working just as hard to stop it.
Well, Dr. Mimi said, we thank you. We do appreciate you taking time out. I know these are difficult moments as well, but certainly do appreciate you taking time out with us this morning right here on Salam Media. We wish you all the best.
Thank you.
Dr. Mimi Sayed joining us this morning, and once again denied entry on her third medical mission to Gaza. She has served as a doctor twice in 2024, and finally, just as Dr. Mimi says, we need to continue regardless. We need to continue with our activism, with our advocacy, and we should not stop until this genocide ends. And with that, we're going to go for a quick break. We come back, we'll be joined, Maulana Muhammad Tariq, the Ummah uniting in a nationwide protest against Sahuk.